All right, good. Hello, everyone. We discussed in our previous revision that we'll be talking about the muscles of the wrist. So, what I want you to have a look at these images. These are randomly taken from the Google or yeah. What I want you to have a look muscles of the hand. This is the way maybe we can have a bigger picture. This is the dorsum. Maybe we can have an image view like this. Okay, now this is the dorsum of the hand, and you can have a look at all the muscles of the forearm that we were talking about. Have a look over here. This is femoris brevis. This is flexor retinaculum here. This is flexor carpi ulnaris. Have a look here. This is the tendon. Femoris longus muscles tendon. Flexor carpi radialis tendon. Coming here to the thumbs muscles, opponens pollicis, abductor pollicis brevis and longer, abductor pollicis brevis, and flexor pollicis brevis here. And this one is flexor pollicis longus tendon, of course. Abductor pollicis, this is the transverse one, right? And these are the four lumbricals, 1, 2, 3, and 4. 1, 2, 3, and 4. These are the lumbricals. This is the sheath of flexor tendons and the flexor distrum. See their submission, their insertion. Flexor distrum profundus insertion. Have a look. Very important. Many MCQs can come on this, and it's very important. You have to know how flexor distrum superficialis is inserted and how flexor distrum profundus is inserted. So this is flexor digiti brevis, abductor digiti minimi over here. Again, starting from femoris brevis. Moving back to the other image, let me try to find any image which shows the hand. This, I think, shows the hand. Oh goodness, this is not a good image. Let me have a look at this one. See, have a look, very important. Thinner muscles of the hand. So these three muscles are called the thinner muscles of the hand. Thinner muscles, they form the bulk of the thumb. So this pink one is flexor pollicis brevis. Have a look. See, have a look. Now this is really good. Enlarged, pink. It's flexor pollicis brevis. This blue one is abductor pollicis brevis and opponens pollicis. All these three muscles act on thumb and have a look. And these are the muscles of the thinner eminence, which form the bulk or the prominence of the palm, which is contributing to the thumb. Right. What I want you to have a look. All muscles. Look at this one. This is showing the hypothenor muscles of the hand. Opposite to the thumb prominence or the thinner prominence, there is hypothenor prominence. Have a look. This is hypothenor prominence. Now this green is flexor digiti minimi brevis and abductor digiti minimi is yellow. So have a look here. This is opponens digiti minimi, this blue. See? Opponens digiti minimi and flexor digiti minimi, abductor digiti minimi. Let me try to find one image which is as enlarged as this one for the back of the hand muscles or the dorsal muscles. You could see these are again the kind of same image I showed you. If we have a look at it again, flexor pollicis brevis, this blue, abductor pollicis brevis, opponens pollicis, these forms the thinner eminence, but I am looking at an image which can show me the dorsum of the hand. Again, no, this is not it. This is it. Maybe this one. Have a look again. Yes. Let's see if it stabilizes. Doesn't. Yes, it enlarges but doesn't become clear. Picture is still blurred. Wait, let me get another good image from the stock of Google. Yes, have a look, have a look. Right, I can't. No better picture than the one I showed you before. Right. Now my next question to you people is, tell me what are the movements which are present at the wrist joint? Have a look. This is a lot much better. This is extensor retinaculum. Have a look. So nice and tidy. You can see. This is radius. This is head of the ulna. And these are the extensor digitorum muscles. 4, 1, 2, 3, 4. Have a look. How they are inserted. Have a look. Very nicely. This is interphalangeal joint. And these are the interphalangeal connections. First, dorsal interossei. Have a look. So big and bulky. First dorsal interossei muscle. And then second dorsal interossei. Have a look. Second dorsal interossei. This is extensor pollicis. See, that's insertion. Have a look. Very nice and very clear. Extensor pollicis brevis. Nice. This is trapezium bone. You can feel it over here. Lateral. Yeah, lateral to, yes, extensor pollicis brevis muscle. And this is extensor carpi radialis longus muscle. Have a look. Extensor carpi radialis longus, extensor carpi radialis brevis. Here, this little one below longus is brevis. Moving here is extensor digiti minimi. This is extensor digiti minimi. And these are extensor carpi ulnaris tendon. See, extensor carpi ulnaris tendon. Very nice and very beautiful and very clearly you can see each and every muscle over here. Very nice. Okay. Now, if I can tell you or if I can show you muscles or with this, I want you to have a look. Have a look. So, let me tell you, what are the muscles or what are the movement I asked you before? What are the movements which are present at the wrist joint? There is flexion, there is extension, there is adduction, there is abduction. So these are the 4 movements which are present at the wrist joint. And what I can say or show you that they are the muscles. All the long muscles crossing the anterior aspect of the wrist joint. We've just seen 3 this. These are the flexors of the wrist. And extensors are again all the long muscles crossing the posterior aspect of the joint. These are the extensors. Whereas adductors of the wrist are flexor carpi ulnaris acting in conroad with the extensor carpi ulnaris. Whereas abductors of the wrist joint are flexor carpi radialis and extensor carpi radialis longus and brevis, together with the long abductor and short extensor of the thumb. Very nice. Good. So these are the four, or should I, these are the four movements which are present at the wrist joint. In next revision, we'll be discussing about the vessels and the nerves of the arm and forearm and the wrist. With this, I'll end today's revision. Thank you all.